Well, if you have leg pain, swelling, or ropey-looking legs, you likely have varicose veins. If you also have trouble walking, you may have a more serious vascular issue. And today, Vascular Surgeon Dr. Tonks, Premier Surgical Vascular and Vein Center here in Knoxville, is here to help us learn the difference between simple vein trouble and more dangerous vascular problems. Hi, Dr. Tonks.
Hi, Justin. Thanks for having me.
Glad to have you with us today. So let's jump right into it. What are the signs and symptoms of vein disease versus vascular disease?
Sure. So I guess we can start by thinking about sort of the two different systems. The veins are the blood that is returning up your legs towards your body. And so if you have trouble there, you typically have dilated blue veins that you may see on your lower legs, swelling, pain when you're standing, symptoms like that. The other system, the arteries in your leg, can cause trouble with the flow down your legs. So you typically have symptoms as you exercise or as you move around. That'd be cramping in your legs, pain when you walk, things like that.
So some very obvious signs for each. Who is most at risk of vein and vascular issues?
Well, there's a huge variety of people we see. So for veins, it's unfortunately it's passed down through genetics. So I've had 20 and 30-year-olds with no other major risk factors other than just getting bad genes from their parents. And then obviously patients that spend a lot of time on their feet or are overweight or just have bad luck can certainly get vein disease.
All right, so it can happen to anybody. So let's get to treatments. What treatments are available for vascular and vein disease at Premier Surgical?
Yeah, so that's one fantastic thing. With evolutions in medicine in the last 15 or 20 years, we can actually treat both of these conditions largely in an outpatient setting. So it's come into the office, have the procedure done with very minimal pain, discomfort, no incisions, and have the procedure completed and go home on the same day, just a few hours later. So
we like the sound of that. In
Absolutely.
And out, get you treated, get you resolved. So what can happen if someone lets vascular disease go untreated?
Sure. So for veins, sort of the worst case scenario is evolving from these blue ropey dilated veins more into ulcers and painful lesions such as that. For arterial disease, we see ultimately can lead to amputations of legs, which is obviously extremely undesirable.
So if someone's having some of these symptoms, they're experiencing leg pain or swelling, and it's affecting their quality of life, what do they need to do?
So, sometimes it's tricky to tell which problem you're having at home by yourself, but that's where, coming to experts can certainly play in. Feel free to give our office a call, and we can sort of help guide you which direction we need to work you up and evaluate and treat both conditions. Right now, we're actually even offering free screenings for varicose veins. You can give our office a call at 865-588-8229 or visiting us online at premierveinclinic.com. So we're available either route.
All right, Dr. Tonks, thank you for this advice today. So if you're not sure whether you have varicose veins, Premier Vascular and Vein Center here in Knoxville is offering free varicose vein screenings by appointment right now. We have the number there on your screen, or you can go to premierveinclinic.com to request a complimentary screening. Thanks, Dr. Tonks.
Thanks, Justin. Great seeing you.